Okay, so venipuncture or phlebotomy is a method of inserting a needle into a blood vessel to drain the blood and also to get stuff in. So the major sites for venipuncture are your cephalic vein, your basilic vein, and your median cubital vein. So I can show you all of these when we come into class, but I have put in many IVs in the hand, uh, and it's very effective in the OR. They like them on the hand because it doesn't interfere with anesthesia. So when you go into the OR, they put your arms out and they put your veins. They want the IVs in your hands so that anesthesia can reach them easily. They also usually like to have one um, in your basilic vein, just because you could put a really big one in there. Okay, blood pressure. So when your heart pumps, it puts pressure on your arteries. So we have talked about our blood pressure before. So when your heart pumps blood to the arteries, the blood filling the vessels is what creates pressure against the walls. Okay, that hydrostatic pressure we talked about. Your systolic blood pressure is a measurement when you hear the first contraction. Okay, so your systolic blood pressure is the first sound you hear is a lub. And then your diastolic pressure is when your ventricles relax, there's less pressure, and you hear the second sound, a dub. So pressure, your systolic pressure is heard on the first sound heard, and your diastolic is the second. So the pressure on your arteries closer to your heart is the highest. And that's why they like to do blood pressure on your arm. Sometimes we have to do it on a leg, but we have to adjust it because it's really not terribly accurate as on the arm. And we use a sphygmomanometer, okay? And it measures the force. So you have to listen with a stethoscope, find the brachial artery. You're going to put the cuff on, blow it up, okay? And then you're going to listen for those sounds. You're going to slowly let the air out and listen for the sounds. And when you hear that lub, that's systolic. And when you hear the dub, and that means when it stops, okay? The last time you hear a sound is your diastolic. So factors influencing blood pressure. You have volume of blood. Somebody who doesn't have a lot of blood in their veins and their vascular system have low blood pressure. When somebody is bleeding out, a lot of times they're forcing blood back into their body because through bags because they have to keep that pressure up. Sorry. You have cardiac output. We already talked about that. So cardiac output, if you're really scared and nervous, your heart's gonna beat faster. Your cardiac output is going to be greater, so it's going to be a higher blood pressure. Blood viscosity. Believe it or not, you can have thin blood, right, from anticoagulants, but you can also have thick blood. So I told you guys I went to give blood one day and I couldn't. They couldn't get enough out of me because I was so dehydrated. So the next time I gave blood, they said, drink a gallon of water that day, and they had no problem. Total peripheral resistance. So people who have smoked and damaged their vascular system are going to have resistance. Their arteries and their veins are not going to work properly. Sometimes people who have damaged veins don't have good valves. And some people who have arteries who have damaged their arteries are going to not be able to, they're going to have more resistance. Elasticity of the vessel walls. People who smoke often lose the elasticity of their vessel walls. You can have aortic stenosis. The pressure is going to be really high trying to get the blood out of that heart, right? And of course, stressors. We all know what white coat syndrome is when people go to the doctor and their blood pressure is higher because they're scared. So when you're scared or you're nervous, you're going to have higher blood pressure. Guys, make sure you read the book on arteries, veins, and blood pressure. It's a good place to read. Your pulse pressure is the difference between systolic and diastolic. So your mean arterial pressure is the average arterial pressure through one cardiac cycle. So systolic and diastolic. So we use that a lot in the OR, but it's not really something that I think you guys need to spend a lot of time on. But it is something that we use, and there is a normal range. In the OR, it's a little bit different. People who had a map of, I don't know, I can't remember, like 60 were fine. It's used to check blood flow to the organs. So if you have a very low map, there's not a lot of perfusion going on. So after surgery, that was really important. Sometimes doctors would accept a lower map, but they didn't want it too low because you got to make sure that blood is getting to the brain. All right, and your pulse. Your pulse is the alternating expansion and contraction of an artery as blood flows from it. So as the heart pumps and it's pumping, the arteries are expanding, and then as the heart rests, they're decreasing. And that's what you're feeling. And they provide information about your heart rate as well as the strength and rhythm of your heart. So when I feel a pulse and it's not regular, I would want to stick a monitor on it. So the first thing I would say is, do you have an irregular heartbeat? And they're like, no, do I right now? And I'm like, oh, I'm not sure. I would stick some electrodes on. A lot of times deep breathing, especially in young people, can make it feel like there's an irregular rhythm when there really isn't. It's just the way when you're breathing, your heart rate might slow. And you can feel pulsing beats at different points of the body. So I normally do radial pulse, but on babies, when they do CPR, it's a brachial pulse. You can do a femoral pulse. Sometimes in the OR, they try to find the mesenteric artery pulses. So if there's no pulses in the mesenteric arteries, they know there's a problem with blood flow to the abdomen. Pulses have a lot of use. You can also put pressure on pulse points to stop bleeding. Temporal artery, carotid artery, brachial artery, radial artery, femoral artery. Popliteal artery is behind your knee, and your dorsalis pedis artery is on the top of your foot. So anybody who has knee or hip surgery or abdominal surgery, we always make sure we check their pedal pulses, because if there's swelling in the leg and it starts to impede the artery from blood reaching the foot, we can tell because the pedal pulse gets weak or we don't have one. If somebody doesn't have a pedal pulse for some reason, like a lot of vascular patients don't, they're very weak, we usually get like an ultrasound, and we put gel on and we try to find the pulse using the ultrasound, and then we put an X on it so that all of the other nurses and staff know where to go and put that ultrasound. All right, that's where we're going to stop, and we'll be back the next time with disorders.